Good morning. We'd like to welcome everyone to our webinar this morning. My name is Lindsay Phillips. I'm a healthcare attorney here at Burr Forman, and I'm joined by Angie Smith, who is also a healthcare attorney, and Cayman Cavan, who is in our labor and employment group. And we are excited to dive into this new rule and answer questions at the end of our presentation, any questions that you all may have. So thank you for joining us, and we are going to get started in just a little bit. Again, good morning to everyone, and thank you for joining us today. I am Lindsay Phillips. I'm a healthcare attorney here at Burr Forman, and I'm joined by Angie Smith, as well as Cayman Cavan, who is a labor and employment attorney here at our firm. And we just want to thank everyone for taking the time to join us as we discuss the new COVID-19 vaccine mandate that CMS issued earlier this month. So we are going to go ahead and get started, and feel free to put questions in the Q&A chat box. And at the end of the presentation, we will answer those questions if we haven't already and answer any additional questions that you all may have. So CMS issued its interim final rule regarding healthcare staff vaccination earlier this month on November 4th, and it became effective on November 5th. And essentially, the rule has three primary requirements. One, a plan for fully vaccinating all eligible staff. Two, a plan for providing exemptions and accommodations for those who are exempt from vaccinations. And three, a plan for tracking and documenting staff vaccinations. Covered providers are those who are Medicare and Medicaid certified, and that must follow CMS's health and safety regulations known as conditions of participation, conditions for coverage, or requirements of participation. Covered providers under the rule are here on your screen: ambulatory surgery centers, clinics, community mental health centers, comprehensive outpatient rehabilitation facilities, critical access hospitals, end-stage renal disease facilities, home health agencies, home infusion therapy suppliers, hospices, hospitals, intermediate care facilities for individuals with intellectual disabilities, long-term care facilities, programs for all-inclusive care for the elderly organizations, psychiatric residential treatment facilities, rural health clinics, and federally qualified health centers and rehabilitation agencies. So again, who's covered is eligible staff of Medicare and Medicaid certified healthcare providers. Providers that are not covered by the rule are assisted living facilities, group homes, home and community-based services, physicians' offices, religious non-medical healthcare institutions, organ procurement organizations, and portable X-ray suppliers. But I want to add a caveat to that even if a provider is not covered by the rule, they can still be covered by the rule if they are considered eligible staff. And we are going to talk about eligible staff right now. So eligible staff are staff members who provide any care, treatment, or other services for a covered provider or its patients. So that can include employees, licensed practitioners, students, trainees, or volunteers. This also will include those who provide care and services to a patient or its facilities under a contract or other similar arrangement. So for example, this can include a physician who is treating patients in person, either at a hospital or a long-term care facility. So even though a physician practice may not be covered under the rule, physicians still may have to comply with it. So a little bit more about eligible staff as it relates to contracts and other similar arrangements. Examples of included eligible staff can include hospice and dialysis staff that may, for example, come into a long-term care facility, portable X-ray suppliers, facility leadership or administrative staff who come into the facility from time to time, and that would also include fiduciary board members. Now, providers are not required to ensure the vaccination of individuals who infrequently provide ad hoc non-healthcare services. So for example, if you have someone coming into your building who does an annual elevator inspection, they would not be included. They would not have to be vaccinated. Also, the rule does not apply to those who provide services 100% remotely. So if you have someone who is fully remote and does not come into contact with any patients or any staff that works within the facility, then they do not have to be vaccinated. That includes fully remote telehealth services and fully remote payroll services. But the rule is not limited to those who perform their duties solely within a clinical setting. So many healthcare staff, even though they are not performing in a technical clinical setting, they are still performing their duties remotely. So examples of that would include home health or home infusion therapy. They would have to be vaccinated.
Now we'll talk about the plan for vaccination. Now that you know who is required to be vaccinated and what facilities are required to have their staff vaccinated, I would note that on the slide it mentioned clinics. Just to be clear, that is a clinic that is providing outpatient physical therapy and speech language therapy. It does not mean a clinic that is like a physician office clinic or practice. But the plan for vaccination, it comes in two phases. The first phase being that you're required to have all eligible staff have their first dose of a primary series or a single dose COVID-19 vaccine by December the 6th, 2021, before they provide care, treatment, or services to the facility or its patients. So if you are a person who's got, if you've got staff members who have taken the J&J, that's their single dose primary series. If you have a Moderna or Pfizer vaccine, the first shot of that series is sufficient by December the 6th. The second phase occurs on January the 4th, when all eligible staff must complete the primary vaccination series before providing care or services. So your January 4 deadline, the individuals who have had the Pfizer or Moderna would have to have their second shot by that date. and anyone receiving a one-shot vaccine on January the 4th of J&J is eligible. You do not have to wait the 14-day wait period for them to be providing staff care at that point. As of January 4th, they just need to have the last dose of the vaccine. Additional doses of the vaccine are currently recommended to some individuals, but that does not require that they have a booster dose to be vaccinated under the rule. Next slide. Which vaccines can count towards the vaccination requirement? And those are the vaccines that are authorized for use, either emergency use or regularly authorized by the FDA. And as it stands right now, that is the Pfizer BioNTech COVID-19 vaccine, the Moderna vaccine, or the Johnson & Johnson vaccine. Vaccines listed by the World Health Organization for emergency use, even if not approved or authorized by the FDA, are also considered acceptable. Next slide. Cayman, I want to turn it over to you for the accommodations and exemptions section.
Okay, thank you. So I will cover our medical accommodations and religious exemptions. So as a reasonable accommodation under the Americans with Disabilities Act, CMS does require covered providers to allow exemptions for eligible staff who have medical conditions for which the vaccine is contraindicated. If you receive a medical exemption request from one of your employees, you need to make sure that it includes several elements. One is that it is signed and dated by an appropriate licensed practitioner who is not the person requesting the exemption and who is acting within their respective scope of practice. You want to make sure that that licensed practitioner has documented all of the information specifying which vaccine is clinically contraindicated and the recognized clinical reasons. You also want to make sure that that practitioner has provided a statement that actually recommends that your staff members should be exempted from the vaccination requirement based on the recognized clinical contraindications. It is important to note here that the CMS rule does not allow a medical exemption just because the staff shows that they already have COVID-19 antibodies. Then we get to our religious exemptions. CMS also requires covered providers to allow exemptions for sincerely held religious beliefs, observances, and practices as part of the requirements of Title VII of the Civil Rights Act of 1964. If an employer demonstrates that it's unable to reasonably accommodate an employee's religious beliefs without an undue hardship on its operations, then Title VII would not require you to provide that accommodation. The Supreme Court has noted that if the employer is required to bear more than a de minimis or a minimal cost to accommodate an employee's sincerely held religious belief, it can be considered an undue hardship. So generally, you should assume that a request for religious exemption is sincere. If you have an objective basis for questioning either the religious nature or the sincerity of the employee's belief, you can make a limited factual inquiry to seek additional information. I would caution you there, just make sure you are making a limited inquiry in that area. CMS has also encouraged covered providers to consult the EEOC's compliance manual on religious discrimination for more information regarding religious exemptions, and that compliance manual can be found online. And Angie, I will kick it back over to you.
On the religious exemption aspect of the analysis, exemptions could be appropriate in limited circumstances, and they should not be given just because someone wants to evade or not take the vaccine. The rule requires that covered facilities develop a process for implementing additional precautions if they decide to grant an exemption and an accommodation. Under the CMS stakeholder calls, they've indicated that those additional precautions could be following the core principles of infection control, wearing source control, which is face mask, and submit to COVID-19 testing on a routine basis. I know that some policies have indicated that they might test an individual who each time they come on shift, but there's no requirement that you do the testing in that frequency. Some of the other indications were to do it on a weekly basis. And again, that's just a precaution for someone who you've granted an accommodation who is not going to be vaccinated. Next slide. The other, I should have mentioned as well, that there's some discussion about whether or not you have to move those individuals to a non-direct care patient or not non-direct care role, and that is not required. You do not have to move those individuals who are requesting an exemption or accommodation from providing direct care. That could be an accommodation, but depending on the number of individuals who seek an accommodation or exemption, that may not be a feasible precaution that could be implemented in your facility. So for documentation, you're also supposed to have a plan for keeping up and tracking your exemptions and your vaccinations. And so you must include staff name, date of hire, date of vaccination, the vaccination received, which the type of vaccination received, and the proof of same. Recommend that be the vaccination card. Get a copy of that and put it with their file. The date the staff member is fully vaccinated, so that's the 14 days post receiving the last dose of a multi-dose series. And whether or not they've applied for and been granted or denied an exemption or accommodation request. It does not establish any new data reporting requirements for facilities covered by the rule. Hospitals and long-term care facilities are still continue to provide data to the NHSN reporting system, but this rule itself does not add any additional reporting guidelines. Next slide. So how will CMS enforce the rule? As Lindsay mentioned, the providers that are covered by the rule are obligated to meet the conditions of participation, the conditions of coverage, or the requirements of participation. And so CMS will use those conditions to enforce this rule, and will do it under its survey procedures. Obviously, the state survey agencies are the ones that will be reviewing compliance through the survey process. And that would either be during your regular certification surveys or a complaint survey. You would also see that the enforcement will result in the remedies that are typically imposed in the survey process, whether that be a civil monetary penalty, termination obviously being the worst of that, termination from the program. Next slide. So we've had a lot of questions about this rule and how it applies. And these are a few that have already been submitted, so we'll cover those first. And the question was, are there any lawsuits in Alabama or other states that have had hearings or are about to that could result in some form of injunction, putting a temporary stay on the mandate? As many of you may know, the OSHA emergency temporary standard has been stayed by a court, but there has not been a stay on the CMS mandate. There are several lawsuits that have been filed. Many states have filed lawsuits, including Alabama, asking that the court enjoin the CMS mandate as well, but there is not currently an injunction or a temporary restraining order that could potentially come out in the coming days. But as it stands now, we expect this rule to go into effect December the 4th. And so you must be prepared for that date, for the phase 1 date. Next question is, does the rule apply to physician offices? No, physicians' offices are not covered by the CMS mandate. There may be other issues with vaccination, as Lindsay discussed, with physicians going into other healthcare facilities that are covered by the rule that would require those staff members, whether it be a nurse practitioner or a physician who has admitting privileges at a hospital, to undergo required to have the vaccine because of their participation in providing services and care in a participating or covered facility. Next slide. We're asked whether or not anxiety or obsessing over the vaccine would qualify as a medical exemption. I would refer everyone back to the medical exemption requirement form, which has a licensed practitioner who's not the individual requesting the exemption to complete the form saying what the contraindication is and what the medical condition is that would prohibit them from being vaccinated. If a medical practitioner deems that anxiety or mental impairment is such that they recommend that the individual not be vaccinated, then you can accept that exemption. Would an employee's personal health information be protected if their physician signs the medical exemption request, but does not disclose the diagnosis condition he or she feels preclude the employee from taking the vaccine? I can ask Cayman to chime in here too as well, but if the individual is requesting a medical exemption, they, by virtue of asking for that exemption, are going to have to release information about what conditions it is that makes them not eligible for the vaccine. Otherwise, the facility would not be able to grant that exemption. So they're going to have to provide an authorization for their health care practitioner to release that information to their employer. Kevin, do you have any additional thoughts on either one of those questions?
The only thing I would add to the second question, if an employee presents issues with personal health information, that exemption request would be stored confidentially in the medical section of their personnel file. So you could go ahead and reassure them of that.
Thanks. Next slide. There was some other questions along the way about what falls under arrangements or contract personnel. I know that during the testing for nursing homes and from some other facilities, that the EMS personnel claimed that they were not covered by the rule. They are not specifically covered by this rule. However, because they provide services under arrangements and under contract with facilities that are covered by the rule, those employees or those individuals who are coming into the nursing homes or hospitals or other covered facilities would be covered and would have to have a vaccine, just like any other staff member that's entering the building. There's some other information in the interim final rule preamble that talks about the types of individuals who you might want to consider requesting proof of vaccination. I think Lindsay covered the ad hoc individuals, someone who's coming in on an infrequent basis. We know previously in guidance that they provided, they talked about a weekly sort of frequency in determining whether or not the testing rules would apply. They did not do the same in this rule. They determined that would be left up to a determination by the facility, that, determining how frequently someone is coming into contact with the patients or staff then would make them subject to the vaccine requirement. I don't see any additional questions. Wait, here's one. It says, what about new hires after 1/5/21? Is there time to get them vaccinated, or must they be fully vaccinated before being hired, allowed to work? That's a great question. And actually it's one I've submitted to CMS. The way I have read it is that there is no grace period for unvaccinated workers. Even if they get the first shot as of 1/5, I believe they will need to wait until they are fully vaccinated before they can begin providing services, because there's not that grace period. It seems to me it would be reasonable to allow those individuals to work as you would someone who's been granted an exemption or accommodation, but that's certainly not something that's been issued in the rule, and I have not heard that or seen that in any of the frequently asked questions. So anyone who's hired after 1/5 would need to be fully vaccinated, which means, the 14 days post their last dose, prior to providing services. Any other questions or comments? Lindsay, Cayman?
I don't have anything.
I don't have anything either.
All right. Well, thank you all for attending today's webinar. It has been recorded, and we appreciate your time. Have a great day.